So we're celebrating that it is the United Nations 75th anniversary, and we're interested in the past, present, and future. We're also the 72nd anniversary of human rights.
Which one's that slide?
Sorry, stuck on slide 1.
Or does it say slide show up this? I can't get in it. Where does it say slide show? Begin from here. What's that say?
From beginning.
All right, there you go.
Okay, finally got it. Okay, United Nations Association, and we're the Kentucky division. A little bit about UNA USA. We hold different meetings to let people know about a lot of the things that the United Nations is involved in. And we have about 200 chapters across the country and from every state. In 2011, we became a program of the UN Foundation. I was there to sign documents for that. And we're also, our sister organization is the Better World Fund. And together, the three of our groups are the largest advocacy for the UN. We do ask for full funding from Congress for the United Nations. And we are a part of the World Federation of UNAs called WAFUNA, and that is composed of 93 countries. In Kentucky, you can see that we have not only the division, but we have in Lexington, Frankfurt, Louisville, and we have 2 chapters at the University of Louisville, UNA at U of L, and UNA Eddie, can you help me with this? And we also have UNA Women at U of L campus chapter. We also work on the Sustainable Development Goals. There are 17 of those. We're specifically working on number 5, gender equality and empowerment of women, specifically in the human trafficking area. And also number 6, SDG number 6 for clean water and sanitation. The first framework that was set was for the 8 Millennium Development Goals that ran from 2000 to 2015. And the second framework is now the 17 Sustainable Development Goals, or SDGs, that runs until 2030. We are free to work on any of these that we want to. As I said, we basically, the division has concentrated on human trafficking as well as forever chemicals. We just held the UN Day event recently in October, and we added in the forever chemicals. And I'd like to give a shout out to Thatcher Walton. I don't know if he's able to make it tonight or not, but he is a student journalist, reporter, and author. And you can catch his report here, thegreenreport.org. Forever chemicals in Louisville's drinking water. Is it time for action? And hopefully he'll be able to make some comments tonight. So the topic is taking action on forever chemicals, PFAS, exposure of a massive public health threat. And this is, of course, like I said, SDG number 5. So when we look at the PFAS chemicals, they're composed of PFAS, PFOA, and then PFOA was changed to be C8, which was still really a bad chemical and was banned in the United States. And PFOA was phased out. And then DuPont came up with a trade name of Gen X, which also has problems. So in general, we're going to look at the brief history of where these man-made chemicals came from, what's in your water, and what are forever chemicals, and where are these chemicals found, and what are the potential health effects, and what can you do now. To get the symbols out of the way, let's talk about this group of man-made chemicals that have been with us. Unfortunately, we didn't know about it for decades because no one provided the information. But PFOA and PFAS are the most studied, and they do persist and they don't break down in the environment. And they can remain in the human body where they can bioaccumulate. They can remain in the environment for thousands of years, and there are about 60,000 variants of these chemicals. But PFAS stands for pure and polyfluoroalkyl substances that are basically the PFAS and the PFOA. So the technical name for PFAS is perfluorooctane sulfate, and PFOA is perfluorooctanic acid, PFOA. Due to the health maladies that they had with PFOA, they stopped making those in the US about 2 years ago. And also, then they tried to put out the C8, as I mentioned. These are 8 carbon molecules that are in a line. They are so tightly linked that you cannot break them. They will not break apart. And that is why they're so dangerous. They cannot be broken. But the PFOA was replaced then, the C8 then became Gen X. But the health impacts of Gen X also do not look very dissimilar from the PFOA. So when we're talking about PFAS, it's a combination of PFAS, PFOA, or Gen X, C8. A brief history, it began with 3M, that is a $120 billion conglomerate. 3M developed the first PFAS Scotchgard. If you can remember back in the 70s when you had Scotchgard and you would spray a sofa or chair to help protect it from if someone spilled a Coke or grape juice or something on it, that you could wipe it off. In 1946, DuPont also began working on Teflon. And so many people, so many cookware has Teflon in it. The PFAS, these toxic fluorinated chemicals from 3M for years in the beginning. And actually the way that 3M later got into making for firefighting, chemicals for firefighting, was because the Navy asked for their help after the fire claimed a lot of lives. In 1975, there was a University of Florida researcher, Warren Guy, and he was working nearby. I don't know whether it was the university or his home, but he found that he had these fluorine molecules in his blood. So he just picked up the phone and he called 3M and found that he was correct. And it took him about 4 years before they came back and they said, yes, those are the chemicals from us, and that they actually came from the 3M location. In 2000, the United States started phasing out some of these chemicals. And in 2001, the Teflon plant that was in West Virginia had media exposure of many, many health problems. There were 460 articles in the Star News in North Carolina. We really don't see the news on this in Louisville, unfortunately. North Carolina Governor Cooper created a science advisory board, And the FBI there is looking into if there's evidence of criminal violations of their permit or regulations. So around 2013, 14, PFOA was to no longer be made in the United States. They were phasing it out. It took them about 3 years until about 2017 to phase out. But then the C8 again showed the same problems. And so these PFAS remain in the environment, in the water, and in people. Then DuPont, because of the problems they had in North Carolina and the lawsuits, they began to spin off part of their company. They spun off and created DuPont Chemours. One of the two DuPont Chemours is here in Louisville, Kentucky. Later, DuPont continued to split its company in April of 2019 into Dow Distribution. Louisville is also has DuPont adjacent to DuPont Chemours in Louisville, close to the Ohio River. They also created Corteva, and I read just the other day that Dow was bought out by Corteva and DuPont. So DuPont has lowered the amount of money that it has to about 14 billion, and has continued to split it into so many different companies. And I really wonder if they are a monopoly, even though they have created other companies. So the PFAS chemicals they're a family, like I said, of thousands of chemicals that you encounter every day in your life. And the reason they were made is because they repel oil and water and grease, and these chemicals do not break down, and they can bioaccumulate in the body of humans and animals and wildlife and fish. And so where are they found? They're found in the water, surface water, groundwater, streams, rivers, rainwater, even when the rain comes down, drinking water, and wastewater. They're also found in soils, sediment, and biosolids. They're in the air, in air emissions. They're in the airports, the industrial sites, in electroplating. They're in carpets and furniture and wiring. They're in your clothing. If you have a raincoat and it repels water, if you have any fabrics that of clothing that repel water, the Teflon nonstick cookware, anything that has that in it, food and food wrappers. If you get a hamburger, the grease no longer comes through the paper that it's wrapped in. If you have a popcorn bag and you put it in the microwave and the grease doesn't come through. If you have the cardboard pizza boxes, and if any paper coating companies are around. They're found in consumer products, in cosmetics, in the dust, in the firefighting foam. So the PFAS are also found, like I said, on the industrial sites, airports, firefighting training stations, military bases, naval ships, and where fires were to put out the fire using the foam. And this was created when the Naval Research Laboratory called 3M and said, you know, our aircraft carrier killed about 139 sailors who couldn't get out, and also injured about the same number of airmen. So there is a congressional plan. Just today, I got the information, and I have that in the chat, where any groups could sign on to the National Defense Authorization Act, in which multi-millions and millions of dollars will be given, because there are about 700 military bases that need to be cleaned up. and also, like I said, the airports and other industrial sites. But these foams are needed, but they can try to create something different that won't continue to contaminate the earth. Also, the downside is that these chemicals are linked to cancer, liver damage, harm to the reproductive system, and harm to the immune system. When we talk about harm to the immune system, we have to worry that even a vaccine for the SARS-2 virus, people are showing less immunity, and whether or not these chemicals could be involved in that problem. So the Environmental Working Group in June of this year also reported that the US EPA finalized a rule that would help with regulating PFAS, but it really doesn't help, because what it does, it just requires that if something is coming from another country, only the surface coating cannot be PFAS. However, it can be inside of that, and this really needs to be changed, and perhaps it will be changed. One of the bright spots also is just a couple of days ago that President-elect Biden has pledged to help with PFAS. Some years back, these chemicals were called perfluorinated chemicals, PFCs. So some people sometimes may refer to them as PFCs. But anyway, as you can see, this is DuPont's poison legacy and how harmful Teflon is, even in small doses. One of the things that there was a 2020 program with Barbara Walters in which the Environmental Working Group was there, and they had the stove and they were trying to cook bacon, and they had a representative there from DuPont. The representative is saying, you know, that it's not harmful, the Teflon, but they found that when you heated the pan over 500 degrees, when you heated it up to like 600, 675 degrees, which they had a special thermometer to tell that, because bacon does not cook at 500 degrees. It has to be hotter. So that what happens is when you're cooking this and it's getting hotter and hotter, these fumes start emanating and coming off of this. And if you're inhaling those fumes, you're getting about 6 chemicals that are going to embed in your lungs. So it is dangerous. So some of the health effects they found of the polyfluorinated chemicals, which are the PFAS, has been kidney and testicular cancer, high cholesterol, abnormal thyroid hormone levels, and pregnancy-induced hypertension and preeclampsia and obesity. So these really do pose substantial risk of injury. And the one toxicologist said that the same health effects that you see with PFOA, that there's no way that you can call Gen X a safe substitute. Currently, just shockingly, China and other countries are still using C8, which is banned in the United States. And they have been producing all of this PPE in surgical hospital gowns, shipping it over to America for frontline medical personnel during this 2020 pandemic. They need water resistant, because if they're in a patient's room and there's any blood or tissue juices or anything like that, they don't want that to permeate the garment, the gown, to get onto the person's clothing. But it's also used in feedstock and really was bad, and we're fortunate that it was taken away from here. However, some people refer to C8 as PFOA, and it has been linked to 6 diseases. And these were in North Carolina. They came out with kidney cancer, testicular cancer, ulcerative colitis, thyroid disease, pregnancy-induced hypertension, preeclampsia, and hypercholesteremia. So you see that some of these are repetitious. They're found over and over and over. Gen X is a trade name. It's a made-up name developed by DuPont. And out of 40 cities, the study by the Environmental Working Group, the highest value was found in Brunswick County, North Carolina, and Louisville, Kentucky has the second highest value of Gen X. Environmental Working Group looked at 27 fast food chains using paper or paper cardboard, like for pizza boxes. And they found kidney cancer, testicular cancer, high cholesterol, abnormal thyroid levels, pregnancy-induced hypertension, preeclampsia, and obesity, which, I just went over, and you can see that they're finding the same things over and over again. And Gen X was found to be much like PFOA regarding the health of the liver, the kidney, and reproductive harm. Other health effects that have seen that you should really know, and it's really important to know, that the PFAS are in the blood of nearly all Americans. The study that was done by CDC was 99% of the people living in the United States has PFAS in their blood, even that of newborn babies. So we mentioned the human exposures for food, water, dust, air, or consumer products. I think you're going to begin to see more labeling of consumer products, makeups, cosmetics, things like that. They are poorly absorbed through the skin, but they still go through the skin. So I want to point out specifically what the Environmental Working Group had to say there in the center, that they found testicular, kidney, liver, and pancreatic cancer. Ruth Bader Ginsburg passed away with pancreatic cancer, as did the one talk show host that just recently passed away. Weakened childhood immunity, low birth weight, endocrine disruption, increased cholesterol, weight gain in children, and dieting adults. We'll go down here to the bright pink CDC. They found cancer, liver damage, decreased fertility, and increased risk of asthma and thyroid disease. I think these are things that we find in the Ohio Valley as well. So how can we remove these chemicals? How can we get rid of them? It's going to take you. You're the one that can help bring about the changes. We've already tried to deal with the water company, and if Satchel's on the line, he can tell you his personal story of talking with the Louisville Water Company spokesperson. But what is needed is activated granular charcoal filtration. But that's not going to remove the Gen X. So we're going to need to use reverse osmosis, the membrane filtration, to remove the Gen X. Now, what happens now, the charcoal filtration occurs about 3 months out of the year when farmers are actively farming and applying pesticides and insecticides. And the Louisville Water Company is removing at that time. And if there is an as needed basis, if there's another time that they would need it. However, we are insisting that this charcoal filtration occur 12 months out of the year, and not just 3 months out of the year, because a lot of other things can be removed. The same with reverse osmosis. A lot of other things can be removed with reverse osmosis, and we don't need to be drinking all these things. We don't need to be drinking all the drugs that other people are taking, and antibiotics and things that, we don't really need that. And it's best if it can be removed. When we look at the wastewater treatment, the Metropolitan Sewer District should also be using these methods, especially the Morris Foreman wastewater treatment plant that sits on the Ohio River. because if you're not aware, the sludge is trucked from every um, regional wastewater treatment plant to the Morris Gorman plant where it's processed, and then it goes into the Ohio River. We have many people that live below us that water is withdrawn for their drinking water. So at home, you can do a carbon filtration, reverse osmosis, and anion exchange treatment. A disposal of these membranes would be incineration at designated and approved places, because I know MSD said they wouldn't know what to do with the membrane if they had the chemicals on it, but it's readily available to find. So to become more informed, I ask that you watch the movie Dark Waters. It was written by the person that lived the life, which is attorney Rob Billett, and he helped a farmer who had lost nearly all of his cows that was near DuPont. And then he took on clients 3,535 class action lawsuit and won $671 million for them. He does have a book out also that's called Exposure. Satchel put me on to The Devil We Know, and that movie talks about the findings where DuPont had done a study that wasn't revealed until after Billett did his work and found what the research that had been done for decades. But in The Devil We Know, DuPont had done studies on mice to find facial deformities of like one eye lower than the other. And what happens is that two women who worked at DuPont who had the same job out of 7 women had a son. One was Bucky Bailey, the other was Chip, from 2 different women. The one, and both of those boys had an eye that was lower than the other eye and only one nostril. The one has undergone more than 40 surgeries during his life. He's about 40 something now, but but anyway, you know, you can find out more about this if you read this. I mean, if you watch this movie. And currently being made in the makings right now here in Louisville is Gen X, a chemical cocktail. You can only see the trailer on that particular one. I ask for your help with the 3 bills in Congress. All you need is this one number to call the White House operator. They're there 24 hours, 7 days a week. You can call anytime. You can call now, 202-225-3121. You just ask to be connected to Senator McConnell's office or whoever your rep is. The first bill that's important is HR 535. The name of that is PFAS Action Act of 2019. And that has already passed the House. It's been in the Senate since January 2020. And calls need to go to US Senators Mitch McConnell and Rand Paul. They could also go to the President. But it would make that within a year of the passage, the US EPA administrator would designate PFOA and PFAS in their salts as hazardous substances. This is really, really important. A lot of these places may become Superfund sites when this happens. So they will fight it as much as they can. But also the administrator would investigate methods and means to prevent contamination by Gen X of surface waters, including source waters used for drinking water. And then 5 years later, I mean, this hasn't even passed yet. So, I mean, we're talking 6-7 years from now. The EPA administrator shall determine whether to designate all per and polyfluoral alpha substances, PFAS, as hazardous substances individually or in groups. So you call your senators on that bill. These last 2 bills, you would need to call your state representative, not state, I'm sorry, your federal, your US representative. HR 2377 is Protect Drinking Water from PFAS Act. it would amend the Safe Drinking Water Act to require the administrator of US EPA to publish a maximum containment level goal and promulgate a national primary drinking water regulation for total PFAS substances and for other purposes. The other bill is HR 2605, the PROTECT Act, which stands for Prevent, Release of Toxic Emissions, Contamination, and Transfer Act of 2019. This one will specifically address hazardous air pollutants. And this is really important that our air also be monitored. So more actions that you can take, you can contact the water company or water company wherever you are to ask if wherever chemicals, PFAS is being detected in your water, ask the information be sent to you electronically. If you need to ask for this under Kentucky Open Records, just do that. Say under Kentucky Open Records, I want to get the information electronically, and it won't cost you. Ask your water company to disclose the information on your water bill. We would like to see Louisville Water Company disclose this. The reason they don't disclose it and the reason they don't act on this, even though it's being detected in our water right now, is because these are unregulated chemicals. When the bills pass in Congress, they will become regulated, and the water company and the other places will have to meet those standards. They won't be able to discharge just whatever they want to discharge. We want charcoal filtration 12 months out of the year. We want Gen X to be removed using reverse osmosis. And we want these things all year long, every month. And ask your sewer district to also do these same things before discharging into the Ohio River and into our streams. We asked and talked to elected officials to help remove these dangerous chemicals that are found in 99% of us living in the United States. Support nonprofits working to get these chemicals addressed, like Environmental Working Group, Natural Resources Defense Council. These two groups have specifically said the value should be no greater than 1 parts per trillion. But right now, the US EPA administrator, the US EPA has said an advisory level, which is not regulated, they set it too high at 70 parts per trillion. And other states and other cities are acting when it is far, far lower, when it is maybe 2 parts per trillion, up to 6 parts per trillion. They're already acting to remove these chemicals, and it needs to be done everywhere. And we're also know what is happening in Louisville, so we do ask for that. But we ask you to go ahead, use your social media, let your friends, neighbors, groups, acquaintances, family know about it, and thank President Biden, who pledged to help with PFAS. And also 7 of us talked with the Senator Mitch McConnell's DC office on Monday, and they let me know then about the defense authorization bill. So things are happening, wheels are turning. But anyway, I'll end with that and let you ask any questions that you'd like. Thank you.
Thank you, Teena. That was very informative. I know that I had no idea. So let's open it up for questions. Does anybody have a question for Teena on PFAS or anything else that she covered? You can just unmute yourself, or you can pop it in the chat box and we can read it out. While people are thinking, Teena, I have a question for you. Do you know where Kentucky falls nationally with water contamination? Because I know that for the past couple of years, I've always heard that Louisville ranks so well with water quality. So hearing about this was shocking.
Well, I think what people hear is what Louisville Water Company wants them to hear, which is they are the best tasting water. They have the best taste, the water. And Dr. Song is retiring from there, but I was on the Citizens Advisory Committee when it was first formed. with the Louisville Water Company. And for many years, we had someone on that until they ceased doing that, maybe about 3-4 years ago. But no, they have problems, and that's why, you know, they're doing the riverbank filtration. Although some people think that that removes these chemicals, but it doesn't. I mean, they're detecting them. In 2012, the US EPA asked some different places to water companies to start looking for these chemicals, and so they are being detected in our water. On average, the average is 5.6. You're supposed to be able to add, to have individually like PFAS and PFOA, or if you add them together, and they're not supposed to be any more than, they put the 70 parts. But like I said, Environmental Working Group and Natural Resources Defense Council say 1. And, you know, they're finding 5.6 on average here. One of the values was very high. I don't know, Satchel, if you're there, if you want to talk about that. I don't know if he made it, but anyway, I think one value was something like 30 something.
Wow.
You know, and so, you know, sometimes they try to say, well, that was one sample, but, you know, that's what they do, is they take samples here and there, and then they average those samples out. So when you say 5.6, you may have a high point, you know, or a couple of high points, and, you know, maybe a couple of low points, and, you know, so you have to average those out. So we do have those. And also, you know, they have detected plumes coming down the Ohio River in the past, and they try to shut off their water intake at that time. However, they have the problem, they cannot shut it off, but for a certain length of time. If they shut it off any longer, they might not be able to get it to start back up again. So that's a real problem that, you know, they can't do. So, you know, and there are a lot of substances that are not being tested for, that are in our water. It was in 2005 that I first read about antibiotics and hormones being found in our streams and in our water, and I was just horrified. I mean, there are all kinds of articles about, you know, Prozac being in the water, about you know, different antibiotics, and some theories that that's why we're becoming more resistant to the antibiotics that we need.
Wow, that's terrifying.
Well, we had students who stepped forward. I was at a booth for Floyds Fork Environmental Association and Gaslight Festival, and this student comes by, and Corey, he wanted to know, he wanted to do a school project. And anyway, he, you know, whenever he called me a couple months later, and I mentioned different things to him, and when I mentioned the hormones and different things like that being found in the water, he said, that's what we want to do. So he and Mesa did this, and they won the local and the regional, but they didn't win the national for their project, which we purchased the supplies for them to test for the hormones, which they did find in every sample in a segment of Floyds Fork Creek. And then they sampled around the Jeffersontown wastewater treatment plant, above stream and downstream. And so, you know, and also the chemicals were, not chemicals, the antibiotics, they were testing for 17B estradiol, and they were found. So yes, these things are out there, and all of these things are not being removed. However, if we did have the reverse osmosis, a lot of these things would be removed. And, you know, the companies don't want to do it because it's more expense. However, that one bill, the HR 535, it will have 500 million in it. And what I'd like to see is that people be ready, that the companies be ready to put forward, hey, we need this amount of money. And to me, it's not very hard to calculate how much you're going to need for charcoal filtration, because you're already doing it 3 months out of the year. Just take it times 4, and probably that figure would be even less because you can buy in larger bulk quantities, you know. So these are doable things. They're doable. And also in this time of COVID-19, people need to be as healthy as they can be. And you know, what is the cost to the public? What is the cost for pain and suffering? And even in North Carolina, when they put changes in place for their water, it costs the person's $5 per month. We're talking $60 a year. Now, how much does it cost to go to the doctor? How much does it cost to get a prescription? How much does it cost for chemotherapy? I mean, and you know, again, there's the pain and suffering when we might be able to avoid this, but also your immune system would be better, and you would have a better response to maybe fight off some different things, viruses and diseases.
Absolutely. And I'm just thinking from an individual perspective, I know sustainability wise, buying bottled water isn't the most sustainable move. And so we just got a question from an attendee. What can low income Louisvillians do now to lower their risk of exposure to these forever chemicals? Perhaps a Brita system?
Yeah, I've read Brita doesn't remove PFAS. The Brita filters. You know, you can, but these are expensive. You know, I mean, I've done it before, but the problem is you can't afford to take a bath or a shower on a weekly basis. You know, every day or whatever. You can't afford to keep replacing the filters and all. So. There's not a good, the best way is to urge government to do their job to protect the health and the welfare of the public. You know, you have your phone calls are free, or borrow somebody's cell phone, but I mean, just call in and tell them that you want them to address these chemicals, that you realize that they're in your water and that you want them removed and that they should protect your health and welfare. You know, call Congress, you know, I mean, you know, call your local offices as well, you know, talk to the staff. They're working remotely at home during the pandemic, but they will return your calls, you know. So, you know, if you don't know who your person is, who your elected officials are, just call, you know, 574 6100 in Jefferson County, and it's I think 573 6100 maybe for statewide. But all you have to do is call them and give your address, and they will tell you who your local Metro Council person is, who your state senator and representative are, who your congressional people are. Now we all know that we all have you know, pretty much Mitch McConnell and Rand Paul, but each of us will have a different representative. Not that many different, but some of us will have. It could be Thomas Massey or some of the others. If you live further away, it could be Andy Barr or some of the others. But these are things that you can find out, and my email is in there. I'm glad to help anybody with any of that. I'm glad to connect them with anybody they want to talk to. I did put in the chat at the very beginning about the letter that is out there. If you want to sign on to that, if you're a group, you can't sign on to it as an individual, but as a group, the multi-millions that are going to be used to help clean up these military bases, and they're also going to monitor the blood of the military personnel, which I think is a step in the right direction.
Absolutely. So the move for us is to take action,
right?
start a conversation.
I'm a really action person.
I love that. That's what we're all about here.
Be persistent. Be persistent. You know, if you call and somebody doesn't answer your call or return your call, call again. I mean, you know, they're human. They have other things that they have to deal with, weddings, funerals, you know, different things, and you know, they don't intentionally, maybe necessarily, or, you know, I know myself, I overlook an email now and then. So, you know, just don't think that they're against you. Just go ahead and keep trying.
Absolutely.
Or contact some civic activist like myself.
Okay, Teena, we have another question. Do you
Okay.
think the new federal administration will take action quickly on this, or will progress stall?
No, no. It's like I said, I'm already overjoyed just 2 or 3 days ago to get that President-elect Biden has pledged that he will help with PFAS. I mean, I'm just elated with that. I mean, I know most people don't know what I'm talking about when I talk about these chemicals, but I'm just telling you, they are a massive public health threat. They are dangerous. They are poison being put in our bodies, and you know, it's unknowingly, and this is really not right. So no, it, you know, already seeing the dynamics of what is happening, you know, being told by McConnell's office the other day that they have this national you know, defense authorization that went out, and then to see today that, you know, the multi-millions of dollars that it will encompass. So I've tried to send out to a bunch of groups today, asking them to sign on, because they have to sign on by noon Friday.
Got one more question. Someone wants to know, is bottled water actually a safer option? A quick Google search said that PFAS and other forever chemicals are still detected in most bottled water.
Yes, unfortunately, there was one company, I don't remember the name exactly, it's something like Spring Hill or Hill Spring or something other like that. But anyway, it pretty much, they are not part of the International Bottlers Water Bottle Association. And so, but after this came to light that there were these PFAS chemicals out there, that international organization, the people that belong to that bottling company, to that organization, they now have to test for that, and they have certain standards that they have told them they have to meet. However, they pretty much talk like, if you see something that says spring in it, that may not be the best water to be taken. I mean, you have the right as a consumer, you have the right to contact that company, which it's easier today to find out if they don't have their phone number on there. Just look up their company, you know, on the internet, and you have the right to ask them, did they do testing for PFAS? And if so, what did they find? And that you would like to have that information. So you're the consumer, you can help a lot with that. But yes, unfortunately, or fortunately, I don't know. But anyway, the water that we have here on Earth is the same water that we've had from the beginning of time. It's just the evaporation that happens, that it comes down on the ground, that it goes back up in the air, it comes down again, but it can catch all these different chemicals and things that are in the air. And so that's where we get into the problem. And also, you know, we mentioned that it goes into groundwater. Well, the problem is then how do you clean up that groundwater when it's already in the soil and all of this? So these are problems that are going to be faced in, you know, hopefully they will start to be worked on.
All right, do we have any more questions for Teena? She's an expert on these PFAS and forever chemicals. Very informative. We just have a couple minutes left if anybody has any additional questions.
I know it's not good news to find out that there are things in your water. We would all like for it to be great, but you know, our bodies are 60% water, and our brain is 73% water. And it's really important what we're putting in our bodies. It's really important for little kids, what they're putting in their bodies. You know, these chemicals started to be created back in the early 40s. And, but these children that are born today, they're going to have to live with these chemicals every day. And they have the potential to have these built up more and to have more exposure to more of these chemicals. And so that's why it's vital that it be addressed today. You know, it's for future generations, you know, and it's also pretty harmful to a person's psyche when they find they can't have children or anything like this. And, you know, we need to remove the possibility that it is the forever chemicals. You know, we need to not have them there. We just don't need them. Scientists can create other chemicals. They can find other ways to do what they want to do. But it does take a lot of research. It does take a lot of time. It does take a lot of money. But what is even one person's life worth? I mean, what is it if we lose an Einstein here and another one there and another one here? I mean, when those persons could have lived a much longer life and been more productive and helped humanity.
Yes, I agree. And knowledge is power. So although it doesn't feel good to hear right now, this is the only way change will happen. So glad to have you on. Jerry said, thanks, Teena. Very informative. I know a lot of our attendees got a wake-up call during this session, but very, very interesting. So thank you for coming on and speaking with us, Teena.
Thank you.
All right, everyone. Well, we have about 2 minutes left. So just a quick wrap up. Thank you, everyone, for being here. It's always great to get a chance to come together as a community, even though we're separated through screens. As I said in the beginning, the Louisville Sustainability Council just launched their community micro grant program, funding different local projects and programs and initiatives for lowering greenhouse gas emissions, building community, etc. So you can find that link and learn more in the chat box. I just dropped that down, and please share with your networks, or if you know any groups that are working on something cool that think that they might want to apply, please share it. You can also follow us on Facebook. That link is also in the chat box. We'll be posting updates on there as well. It's an easy way to share what we're up to with your Facebook platform. So thank you again, Teena. This was awesome. It was great to see everyone, and we hope to see you next month.
Thank you.
Thanks, everyone.